Kerala is on alert after detecting cases of Zika virus. Health Minister Veena George said that the state's first ever infection was reported in a 24-year-old pregnant woman. So far, the total reported cases of the infection are close to 35, of which about 11 are active. All the patients infected with the virus are being treated and are in a stable condition. All the district administrations have been told to keep a close eye on cases of mosquito bites and to conduct fumigation drives. Meetings are taking place between the top officials on finding ways for dealing with the Zika virus outbreak in the state. Besides the outbreak of Zika virus, cases of dengue too were being reported from various districts of the state. Zika is a mosquito-borne virus that spreads through the bite of an infected Aedes species of mosquito named the Aedes aegypti. According to the World Health Organization, Aedes mosquitoes usually bite during the day, peaking during early morning and late afternoon or evening. The Aedes mosquitoes breed in a small collection of water around homes, schools and workplaces. It is important to eliminate these mosquito breeding sites in order to prevent the control of the Zika virus outbreak. This is the same mosquito that transmits dengue, chikungunya and yellow fever. The infected people can also transmit Zika sexually. First identified in Uganda in the year 1947 in monkeys, Zika was detected in humans 5 years later of that. Sporadic cases have been reported throughout the world since the 1960s, but the first outbreak happened only in the year 2007 in the island of Yap in Pacific. In 2015, a major outbreak in Brazil led to the revelation that Zika can be associated with microcephaly. This is a condition in which babies are born with small and underdeveloped brains. For the majority of the people, the Zika virus infection is not a serious issue at all. But this can be very dangerous among pregnant women, especially for the fetuses. The infection can cause microcephaly or other conditions called typically the congenital Zika syndrome. Some of the countries that have had the Zika virus outbreak, including Brazil, reported a steep increase in the Guillain-Barré syndrome. The Guillain-Barré syndrome is a condition or neurological disorder that could lead to paralysis and further to death. In 2017, following a study on Brazil's confirmed cases, the United States National Institute of Health study estimated the fatality rate at 8.3%. The symptoms of Zika virus typically last for a week, and most of the people with the infection do not even develop these symptoms. According to the US Center for Disease Control or CDC, many people infected by the virus won't even have the symptoms or just show mild symptoms including fever, rash, headache, joint pain, red eyes and muscle pain. The symptoms generally last for several days, and if it continues for long, then they might need a hospital care. Additional symptoms can include occasional rash like in dengue, while some other patients may also have conjunctivitis. The incubation period of the Zika virus disease is estimated to be 3 to 14 days. Diagnosis of the Zika virus can only be confirmed by blood tests or through other body fluids such as urine or semen. Zika has no treatment or vaccine so far. WHO says that the symptoms of Zika virus are usually mild and require rest, consumption of plenty of fluids and common pain and fever medicines. In our country, India, Zika virus was first recorded in 1952-53. The latest major outbreak was in 2018 when 80 cases were reported in Rajasthan around the months of September and October. Prior to this, 3 cases were detected in Bapunagar area in Gujarat's Ahmedabad district in May 2017. One case was also reported from Krishnagiri district in Tamil Nadu in July 2017. The government needs to take mosquito control measures such as spraying of pesticides and use of repellents, etc. Because of the possibility of the congenital abnormalities and the sexual transmission, there is also a great focus on the use of contraceptives. The Zika appropriate behavior protocol is recommended to stay safe and be prevented from this viral infection.